ಎಲ್ಲರಿಗೂ ನಮಸ್ಕಾರ. ಐ ಆಮ್ ಡಾಕ್ಟರ್ ನರೇನ್ ಶೆಟ್ಟಿ, ಡೈರೆಕ್ಟರ್ ನಾರಾಯಣ ನೇತ್ರಾಲಯ. ಇಂದಿನ ದಿನ ನಮ್ಮ ನಾರಾಯಣ ನೇತ್ರಾಲಯ ವೈಟ್ಫೀಲ್ಡ್ ಬ್ರಾಂಚ್ ಅಲ್ಲಿ CVI ಕ್ಲಿನಿಕ್ಕು ಇನಾಗ್ರೇಟ್ ಮಾಡ್ತಿದ್ದೀವಿ. CVI ಕ್ಲಿನಿಕ್ಕು ಏನಂದ್ರೆ ಇಟ್ ಈಸ್ ಅ ಕಾರ್ಟಿಕಲ್ ವಿಜುವಲ್ ಇಂಪೇರ್ಮೆಂಟ್ ಕ್ಲಿನಿಕ್ಕು. ಇಲ್ಲಿ ಏನ್ ಮಾಡ್ತೀವಿ ಅಂದ್ರೆ ಎಷ್ಟೋ ಮಕ್ಕಳು ಕಣ್ಣು ನೋಡಿದಾಗ ಫುಲ್ಲಿ ನಾರ್ಮಲ್ ಇರುತ್ತೆ, ಬಟ್ ಅವ್ರಿಗೆ ಕಾಣಿಸಲ್ಲ. ಯಾಕಂದ್ರೆ ಅವರು ಏನೋ ಬ್ರೈನ್ ಪ್ರಾಬ್ಲಮ್ ಇಂದ ಅವರಿಗೆ ದೃಷ್ಟಿ ಬರಲ್ಲ. ಸೊ ಈ ತರ ಮಕ್ಕಳನ್ನ ನಾವು ವಿ ಟೇಕ್ ದೆಮ್ ಅಂಡ್ ಅವರಿಗೆ ಟ್ರೀಟ್ಮೆಂಟ್ ಕೊಡ್ತೀವಿ. ಸೊ ಈ ಕ್ಲಿನಿಕಲ್ಲಿ ಏನ್ ಮಾಡ್ತೀವಿ ಅಂದ್ರೆ ಫಸ್ಟ್ ನಾವು ಈ ಮಕ್ಕಳನ್ನ ಎಷ್ಟು ಕಾಣಿಸುತ್ತೆ, ಅವ್ರ ಮಕ್ಕಳಿಗೆ ಎಷ್ಟು ಕಾಣುತ್ತೆ ಅಂತ ನೋಡ್ತೀವಿ. ಅದಾದ್ಮೇಲೆ ನಾವು ಬೇರೆ ಬೇರೆ ಟೆಸ್ಟ್ ಮಾಡ್ತೀವಿ. ಅವರು ಕಮ್ಯುನಿಕೇಷನ್ ಸ್ಕಿಲ್ಸು, ಲ್ಯಾಂಗ್ವೇಜು, ಐ ಹ್ಯಾಂಡ್ ಕೋಆರ್ಡಿನೇಷನ್ಸು ಎಲ್ಲ ಟೆಸ್ಟ್ ಮಾಡ್ತೀವಿ. ಅದಾದ್ಮೇಲೆ ಒಂದು ಕಸ್ಟಮೈಸ್ಡ್ ಪ್ರೋಗ್ರಾಮ್ ವಿ ಇನಿಷಿಯೇಟ್ ಇವರಿಗೆ. ಈ ಪ್ರೋಗ್ರಾಮ್ ಅಲ್ಲಿ ಏನ್ ಮಾಡ್ತೀವಿ ಅಂದ್ರೆ ಈ ವಿಷನ್ ಸ್ಟಿಮ್ಯುಲೇಷನ್ ಅಂದ್ರೆ ಡಿಫ್ರೆಂಟ್ ಕಲರ್ಸು, ಬ್ರೈಟ್ ಟಾಯ್ಸು, ಆಬ್ಜೆಕ್ಟ್ಸು ಅದೆಲ್ಲ ಯೂಸ್ ಮಾಡಿ ವಿ ಟ್ರೈನ್ ದೆಮ್ ಅಂಡ್ ಸ್ಟಿಮ್ಯುಲೇಟ್ ದ ವಿಜುವಲ್ ಸ್ಟಿಮ್ಯುಲಸ್. ಅದಾದ್ಮೇಲೆ ನಾಟ್ ಜಸ್ಟ್ ದ ವಿಷನ್ ಸ್ಟಿಮ್ಯುಲಸ್, ನಾವು ಬೇರೆ ಸೆನ್ಸರಿ ಸ್ಟಿಮ್ಯುಲಸ್ ಅಂತ ಹಿಯರಿಂಗ್ ಸ್ಟಿಮ್ಯುಲಸ್ಸು, ಟಚ್ ಸ್ಟಿಮ್ಯುಲಸ್ ಅದೆಲ್ಲ ನಾವು ಟುಗೆದರ್ ವಿ ಸ್ಟಿಮ್ಯುಲೇಟ್ ಡಿಫ್ರೆಂಟ್ ಸೆನ್ಸರೀಸ್ ಸೊ ದ್ಯಾಟ್ ವಿಷನ್ ಇಂಪ್ರೂವ್ಸ್. ಸೊ ಈ ಥರ ಮಾಡ್ತಾ ವಿ ಡೂ ಅ ಮಲ್ಟಿ ಡಿಸಿಪ್ಲಿನರಿ ಅಪ್ರೋಚ್. ಅಂದರೆ ಜಸ್ಟ್ ನಾಟ್ ದ ವಿಜುವಲ್ ಸ್ಟಿಮ್ಯುಲಸ್, ಬೇರೆ ಏನೆಲ್ಲ ಮಾಡ್ತೀವಿ ಅಂದರೆ ವಿ ಡೂ ದ ಫಿಸಿಯೋಥೆರಪಿ, ಸ್ಪೀಚ್ ಥೆರಪಿ. ಸೊ ಬೇಸಿಕ್ಲಿ ಏನು ಮಾಡ್ತೀವಿ ಅಂದರೆ ಈ ಮಕ್ಕಳು ಸ್ಪೆಷಲ್ ಸ್ಕೂಲಿಂದ ನಾರ್ಮಲ್ ಸ್ಕೂಲ್ ವಿ ಟ್ರಾನ್ಸ್ಫರ್ ದೆಮ್ ಆ್ಯಂಡ್ ವಿ ಎನೇಬಲ್ ದೆಮ್ ಸೊ ದಟ್ ಮುಂದೆ ದೇ ಕ್ಯಾನ್ ಟೇಕ್ ಕೇರ್ ಆಫ್ ದೆಮ್ಸೆಲ್ವ್ಸ್ and not dependent on their parents. So itara we have almost over the years we have treated about almost 1,80,000 maklu, almost 20,000 maklu special clinic in the special school in the normal school ige we have helped them to transfer. Helbittu ellarigu namaskara. Thank you.
ನಮಸ್ಕಾರ, ನಾನು ಡಾಕ್ಟರ್ ಹರ್ಷ ನಾಗರಾಜ್, ನಾರಾಯಣ ನೇತ್ರಾಲಯ ವೈಟ್ಫೀಲ್ಡ್ ಶಾಖೆಯ ಮೆಡಿಕಲ್ ಸೂಪರ್ಡೆಂಟ್ ಆಗಿದ್ದೀನಿ. ಇವತ್ತಿನ ದಿನ ನಮ್ಮ ನಾರಾಯಣ ನೇತ್ರಾಲಯ ವೈಟ್ಫೀಲ್ಡ್ ಶಾಖೆಯ ಮೊದಲನೇ ವಾರ್ಷಿಕೋತ್ಸವದ ಅಂಗವಾಗಿ 2 ಸೇವೆಗಳನ್ನ ನಾವು ಶುರು ಮಾಡ್ತಾ ಇದ್ದೀವಿ. ಒಂದು ಬೈನಾಕ್ಯುಲರ್ ವಿಷನ್ ಥೆರಪಿ ಹಾಗೂ ಕಾರ್ಟಿಕಲ್ ವಿಜುವಲ್ ಇಂಪೇರ್ಮೆಂಟ್ ಕ್ಲಿನಿಕ್ ಒಂದು, ಎರಡನೇದಾಗಿ ಆಕ್ಯುಲರಿಸ್ಟ್ ಲ್ಯಾಬ್ ಅಂತ ಓಪನ್ ಮಾಡ್ತಾ ಇದ್ದೀವಿ. ಈ ಸೇವೆಗಳನ್ನ ಯಾರು ಉಪಯೋಗಿಸಬಹುದು ಅಂತಂದ್ರೆ, ಮೊದಲನೇದು ಈ ಅಂದ್ರೆ ಮೆದುಳಿನ ಸಂಬಂಧ ಕೊಟ್ಟಿದ್ರಿಂದ ಕಣ್ಣಿನ ದೃಷ್ಟಿ ಬೆಳವಣಿಗೆ ಆಗಿಲ್ದಿರೋ ಅಂತ ಮಕ್ಕಳಿಗಾಗಲಿ ದೊಡ್ಡವ್ರಿಗಾಗಲಿ, ಎಕ್ಸಾಂಪಲ್ ಅಂದ್ರೆ ಆಟಿಸಮ್ ಸಫರ್ ಮಾಡ್ತಿರೋರಾಗಲಿ, ಇಲ್ಲ ಸೆರೆಬ್ರಲ್ ಪಾಲ್ಸಿ ಅಂತ ಹೇಳ್ತೀವಿ, ಅದರಿಂದ ಕಣ್ಣಿನ ತೊಂದರೆ ಆಗಿರೋರು ಈ ಥೆರಪಿಗಳನ್ನ ಉಪಯೋಗಿಸ್ಕೊಬಹುದು. ಇಲ್ಲ ಎಕ್ಸೆಸಿವ್ ಕಂಪ್ಯೂಟರ್ ಯೂಸೇಜ್ ಮಾಡಿ ಅದರಿಂದ ಅವ್ರ ಕಣ್ಣಲ್ಲಿ ಸ್ಟ್ರೈನ್ ಆಗಿರೋದು, ಇಲ್ಲ ಕಣ್ಣಲ್ಲಿ ದೃಷ್ಟಿ ಕಮ್ಮಿ ಆಗ್ತಿರೋ ಅಂತವರು, ಅವರೆಲ್ಲ ಈ ಸೇವೆಗಳನ್ನ ಉಪಯೋಗಿಸ್ಕೋಬಹುದು. ಎರಡನೇದು ಆಕ್ಯುಲರಿಸ್ಟ್ ಲ್ಯಾಬ್ ಅಂತ. ಇಲ್ಲಿ ಯಾರಿಗೆ ಕಾರಣಾಂತರಗಳಿಂದ ಅಂದ್ರೆ ಇನ್ಫೆಕ್ಷನ್ ಇಂದ ಆಗಲಿ, ಬೇರೆ ಟ್ಯೂಮರ್ಗಳಿಂದ ಆಗಲಿ ಕಣ್ಣು ತೆಗೆದು ದೃಷ್ಟಿ ಇಲ್ಲ ಅನ್ನೋಂಥವ್ರಿಗೆ ಆರ್ಟಿಫಿಷಿಯಲ್ ಕಣ್ಣುಗಳನ್ನ ಕೂರಿಸಿ ಅಂದ್ರೆ ನೋಡೋದಕ್ಕೆ ಅವ್ರಿಗೆ ನಾರ್ಮಲ್ ಆಗಿ ಕಾಣುವಂಗೆ ಮಾಡೋದಕ್ಕೆ ಆಕ್ಯುಲರಿಸ್ಟ್ ಲ್ಯಾಬ್ನ ಇದನ್ನ ಓಪನ್ ಮಾಡಿದೀವಿ. ಮೊದಲು ಈ ಸೇವೆಗಳನ್ನ ನಮ್ಮ ನಾರಾಯಣ ನೇತ್ರಾಲಯ ರಾಜನಗರವರೆಗೂ ಹೋಗಬೇಕಾಗಿತ್ತು. ಈಗ ಇದನ್ನ ಇಲ್ಲೇ ವೈಟ್ಫೀಲ್ಡ್ ಬ್ರಾಂಚ್ ಅಲ್ಲಿ ಓಪನ್ ಮಾಡಿ ಇದನ್ನ ಶುರು ಮಾಡ್ತಾ ಇದೀವಿ ಇವತ್ತಿಂದ. ಧನ್ಯವಾದಗಳು.
So we do all those assessments in this room, sir. And we have few things here which people forget which is right, which is left.
Right.
So through the roadmap also you have to turn left, right, no? So we teach them with this navigations with this. So this is the specification of this.
We'll take one photo with the patient.
Thank you. छोड़ दो, ठीक है, दे दो मुझे.
It's a small book.
Okay.
Thank you.
Thank you. Please come.
Hello everyone, I'm Dr. Narayana Shetty, Director of Narayana Nethralaya. Today we are inaugurating the CVI clinic at Narayana Nethralaya Whitefield branch. Now CVI clinic is a very unique clinic. Not many centers in the world in fact have, in ophthalmic hospitals have CVI clinic in it. So what is this CVI clinic? CVI, the meaning of it is Cervical Visual Impairment Clinic. So here when we look at the children, the eye is perfectly normal. There's no problem at all, but the child cannot see. Now why is that? Is because of the brain problem. And in this clinic, we take these children, first we assess how much vision are they using, how are they using it. In different other things also we do assess. We see their motor skills, how their hand-eye coordination is, and also how's their communication skills, behavior skills. So all of this will be assessed, and once it is assessed, we do a very customized program for them in different ways where we can stimulate the vision in terms of bright colors, lights, bright toys, and we have a specialized softwares which is, in fact, most of the equipment is got from abroad. It's not even available in India because we wanted the best devices and the softwares for these children. Once we do the visual stimulus, we do other sensory stimulus also. We do the hearing stimulus, we do the touch stimulus, and this way we do a multidisciplinary approach wherein we also use physiotherapy, which is the other therapist also we use is occupational therapy, speech therapies. So all of them we use them, help the child to be more independent, and we shift these children from a special school to a normal school. So we have treated over 180,000 children now, and almost 20,000 children we have shifted from a special clinic to a normal school. So by doing all of this, we enable the children to shift from a special school to a normal school. So that is the beauty of it, and I'm very excited that we have come to Whitefield closer to, because we have been getting a lot of requests from a lot of patients. Please come closer. As you know, in Bangalore we cannot travel anymore. That is why we are coming closer to you. I hope this will help more and more children, and please kindly spread the word. Thank you so much.
evaluation done in the OPD. Patients will be coming here. So we'll be taking an impression. So these are the impression trees.
So you can say why you are doing this.
Yeah. So if the one who have lost their eyes due to disease or inflammation or extensive injuries will be preparing an ocular prosthesis to give the confidence of the patients who have lost their eyes. So it will match exactly to the patient's companion eye. So these are the impression trees. So these impression trees are available in different sizes. So we'll be measuring the palpebral fissure width of the patient. Impression tree inside the patient's socket. So this is the This alginate powder is mixed with the stars and used through injection cake to prepare the wax model. So once after keeping the wax model preparation is done, we'll insert into the patient's eye socket. I can show you the video.
It's not related to the CVI, inaugurating this
Like
also.
it's not the shells, these are ready-made ones and the
Artificial.
So the wax will be kept inside the gypsum to take up this water. So these are the ready-made artificial clear shells. Only the corneal portion is painted and the rest will be a clear acrylic. This is the corneal button and these are iris discs we use to paint. These are the color pigments. We'll be mixing this color pigment by using monomer or monopoly to take the consistency of the paint. So this is all about the ocularistry.
Good. Fantastic.
Thank you so much.
Thank you.
Okay, so that's why we have specified with the mat. We are very particular with that. So we have not chosen the contrast of the mats, we have chosen it very black, so that when we keep an object it highlights on it. So that specific we have chosen. And this is a software which is used worldwide, and that's the tactile software, because brain needs a feedback mechanism on this, which is right and which is wrong. So when they are touching something differently, I'll show you. So when this pops, it will make a sound. So when it is a perfect one, it will make this sound, and this is a negative wave, a positive wave and a negative wave. So that they'll know whether they are doing it correct or not. So these kids, they'll not have this feedback mechanism, they can't integrate, try to look with the mirror and the trampoline, because if they are sensory low, we'll make them high with the jumping and all those things. We have other instruments for particular things. Therapy, if it doesn't work, only then they are going to the surgery. So the first approach is a vision therapy approach. So we have multiple things. This is for the effusion if they are not able to converge, if the eyes are squinting like this, so they can converge it. So it gives an impulse to the convergent world. So we use liquid crystal glasses for this, which deviates the eye, which gives a separate impulse from right eye and the left eye, so where brain will fuse it. So in squint, they will be having only this impulse, they will not be having this impulse. So because of which they will try to converge, we will bring that potential to converge, to pull the muscle and bring it in. So that's the approach of this software. Very good software which is used worldwide, and exclusively Narayana Nethralaya is using this also. These are multiple things. This is a Marsden ball where the child doesn't have eye-hand coordination or the flexibility of this. We'll give a stick where he'll bump. So if you do this, he'll catch, he'll get an orientation of it. So that's why this is used. And these are the yoke prisms, which in this population of neurodivergence, they'll having a toe heel, they'll not keep the foot flat. They'll have toe walking and all those things. So they will visually feel that the floor is elevated like this. You can try if you want. So when you wear this, the floor is straight, no? So you'll feel the floor is elevated like this, so that they have to keep the foot flat. So these are all the instruments which we use for these kids and for normal kids also, and for the neuro patients like stroke and TBI. So that's the exclusive of this room.
Fantastic. All the very best.
Thank you so much.
So I'm sure, I think you guys are already at it. It's just an official program, so very, very happy and proud. All the very best.
Thank you.
Thanks, Dr. Jyoti, for everything.
And again, I'm trying to get one from NN4, one from NN1, Chetan. He's coming actually. But he's
We
coming.
need a big team, sir, actually,
Yeah.
because
It's a lot of
when this kids comes, 45 minutes we have to sit down.
And they actually sit. I've seen them 45 minutes per patient, and there are people waiting. So they're doing. Both of them are doing very good work and dedicated. So it's really just the beginning. We started NN4 in October, and we have daily 15. And they finish a course, but again we have new people. But it's constantly going on. That's the good part. And he goes around telling people that there is this therapy available. Please come. So all that talking and all is also going on. So that's very good.
Because in this 10-kilometer radius, only Shankara was having the vision therapy. And when I said we have it, they were like surprised to know. And they were like, no, then people have to come here because they know what Narayana Nethralaya doing is. So because of which we did a small publicity of this. So we are expecting a few more therapists also. I said we have arranged a talk on this so that they come to know what we are exactly doing.
And we do that. A lot of people who are coming from here, we tell them, no, you follow up here. So that wherever it's closer, then they take advantage of the home.
Well,
Thank you.
Fantastic. Thank you so much. Thank you. Okay. But remember that station is still not open. 6 months now.
But okay. Go to Majestic. Go to Majestic. Majestic is good.
Hello, I'm Dr. Harsha Nagaraj, Medical Superintendent of Narayana Nethralaya Whitefield branch. On the occasion of our first anniversary of Narayana Nethralaya Whitefield branch, we are opening two services. One is what we call the binocular vision therapy and the cortical visual impairment treatment department, as well as the ocularist lab. In the binocular vision therapy, what we are doing is we are helping out those professionals who work on excessively on computer usage and have symptoms related to dry eyes, strain and all those. We evaluate their eye muscles and see if there are any symptoms due to their muscle spasm and teach them exercises where they get relief. In the cortical visual impairment therapy department, we treat those kids and adults who have vision problem due to either their neurological problems such as autism or maybe due to cerebral palsy, etc., where they can be given multiple sessions and treatment to improve their visual acuity. The other department is the ocularist lab, where people whose eyes have been removed due to multiple reasons like either infections or malignancy or something, where we're going to provide them with artificial eye prosthesis which will make them look better cosmetically. Thank you.